Hello, I'm David Munday, the Public Health Consultant for Reading. And as today is the day that we move out of lockdown 2 and we move into tier 2 of these 3 local alert levels, I wanted to take the opportunity just to update you on what's happening in Reading and particularly how our infection rate looks locally. But firstly, I just wanted to say a big thank you to everyone for following the lockdown rules so well here. It really feels to me like we've been collectively doing the right thing for Reading and following the requirements during this second lockdown. The data that we have now on infection rates in Reading shows the very first signs that we are seeing a decline in the infection rate here, which is really good news. Over the month of October, we saw our infection rate rise from 30 cases in a week for every 100,000 of people up to around 140, so almost a 5-fold increase. During the first 3 weeks of November, those numbers plateaued at between the 140 and 160 mark. Over the last 2 or 3 days, we've just started to see that number drop down, and it's now between 120 and 140. The data released yesterday evening showed it was 139, but we're just starting to see that decrease. We're just below the regional average around the southeast, also below the national average. So I think this shows us that the actions that we've taken have started to have an impact, but it is too early to say that we are inevitably going to see a continued decline. And really, we do have to continue to live our lives in COVID secure ways. And moving into tier 2 today, really the key message, I know there's been quite a lot of coverage about exactly what the different rules are in the different tiers. The key message is that in our alert level, in tier 2, we must not mix with other households in an indoor setting, whether that's in our own homes, whether that's in a cafe, a restaurant, a pub, other environment. And the reason for that is we know that in poorly ventilated or in indoor areas, the virus transmits far more easily than in an outdoor setting. So you can meet up with people from outside of your household in an outside setting, up to 6 people, but not indoors. And it's really important if we want to see that decline in the numbers really be a sustained decline, and we want to move down the alert levels to tier 1, it's really important that people stick with that. You may have also heard in the media quite a lot reported about vaccination and the development of vaccines. And today, the Pfizer vaccine has been approved for use in the UK. And we expect that the AstraZeneca vaccine developed in Oxford will be approved in the coming days. So we'll be saying more about the vaccination programme, how it is being rolled out, and to which residents first in future updates. You may also have heard some communications and media coverage about these new lateral flow tests, which provide a rapid result soon after, about 30 minutes after someone takes the sample, and doesn't require processing in a laboratory. So these are an exciting development. And again, we'll be looking at how they're best used for particular parts of Reading or for particular people in Reading over the coming weeks and months. So again, more on that to follow. And finally, again, regarding Christmas, I think we all know that Christmas is coming, and there's been discussion about the change of rules for that limited period over Christmas, and whether you've gone early with the Christmas decorations or not. In my household, it's the children are very excited about their advent calendars. They will again make sure that we communicate clearly with everyone regarding how we remain COVID secure in the Christmas period. So more on that to follow. But thank you for all of your hard work. Thank you for following the rules in Reading. We are beginning to see that downward trend, and let's continue to do the right thing for Reading. Thank you.